It's already 2 o'clock. We start. So welcome all. I'd like to remind everybody to mute themselves, but always show your video picture so that I know who are my attendees. Okay. Please sign in your name, Facebook account, or email address in the chat box. Include names of the companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. So there will be group pictures at the start and end of the pep talk. So please show your face in the video. As a reminder, please take the online learning CUM evaluation test exercise, or OLETE, for mastery of learning, and try to get the perfect score to get the certificate. So I have placed the link in the chat box. The certificate looks like this. Let me report to you that as of today, at 1 o'clock, okay, there were 33 complete OLETE passers. Okay, so thank you and congratulations for those 33 who have completed the OLETE as of this time. Okay, so this is a great accomplishment compared to the number was 28 in August 14 and 22 in August 7. So I hope more will catch up. So let's now have a group picture taking before we start in 2 minutes. Please turn on your video, show your face. Just put gallery view. Okay. Okay, there are 2 pages. Let's start. Page 1. Okay, 1, 2, 3. Let me just save this first. Page 2. Okay. Show your face. Ready? 1, 2, 3. Okay. Okay, let's start. The title of my pep talk today will be Basic Rights in Patient Empowerment. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I launched this pep talk on May 15, 2021 with the module on COVID-19. The second module was on patient empowerment. The third module was on patient management process. We're now on the fourth module, which is entitled Rights in Patient Empowerment. What I have in mind in my pep talks, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. There are 2 parts in the fourth module, basic rights, which we'll tackle today, and then the other one is patient autonomy and advanced directive. So for today, we will be talking on the patient rights in patient empowerment. The objective will be for the lay people to have an understanding of the basic rights in patient empowerment. The World Health Organization defines patient empowerment as the process through which people gain greater control over decisions and actions affecting their health. The WHO has identified 4 components as being fundamental to the process of patient empowerment. One of which is, the first one is understanding the role. Okay? So in the WHO definition, the rights in patient empowerment can be subsumed at the very least under this particular phrase, understanding the role. In a community of inquiry or survey that I conducted in June 2021, this year, among 55 Filipino respondents, we agree that patient empowerment can be translated in Filipino as pagpapalakas ng pasyente with the following 4 strategies or K4: kaalaman, knowledge and understanding; kakayanan or capability; karapatan, rights; and kapangyarihan or self-determination. So karapatan means rights in patient empowerment. Before I go to the rights in patient empowerment, let me remind everybody that everyone has the right to health, which is part of the human rights. The right to health means that the nations, the states, or the countries have the legal obligation to promote the health of their citizens. The right to health has 2 components: freedom and entitlement. Okay. Freedom includes the right to control one's health and body, including sexual and reproductive freedom, and freedom from interference such as non-consensual medical treatment and experimentation. Whereas entitlement includes access to adequate healthcare facilities and services. This will be provided by the country or the nation. So rights in patient empowerment emanate from this human right on health, specifically on the freedom or the right to gain greater control over decisions and actions affecting the health of the lay people or patients. Every person has the right to make his own choices with regards to his health and health care. In the medical world, one of the principal ethical principles that has been established and being observed and being practiced by all physicians is patient autonomy. And patient autonomy means the right of the competent adults to make informed decisions about their own medical care. This principle underlies the requirement to seek the consent or informed agreement of the patient before any investigation, like laboratory examination or treatment, will take place. So the foremost right in patient empowerment is for everybody, physicians and healthcare providers, and even relatives included, to respect patient autonomy. Again, to repeat, patient autonomy is the right of all competent adults to make informed decisions about their own medical care. There are 2 keywords or phrases in the definition: competent adults and informed decisions. Competent adults means conscious, coherent, and discerning adults. Informed decisions means a permission or no permission is granted by the competent adults after this will occur only after proper understanding of the purpose of the procedure, options, different options for the procedure, with benefit, risk, cost, availability, data analysis, and consequences of the procedures to be undertaken. These 2 components or requirements must be fulfilled, meaning competent adults and informed decisions, for patient autonomy to be ethically and legally binding. Patient autonomy should be observed when a patient is being managed by a physician in whatever setting, such as when consulting at the clinic, at the outpatient departments, or inside the hospital as a confined patient. And patient autonomy should also be respected when being managed by relatives or significant others. When being managed by a physician, patient autonomy should be respected before any paraclinical laboratory diagnostic procedure and or treatment procedure take place. After the patient is properly advised, respecting patient autonomy can end up in either informed refusal or informed consent. With informed refusal, no paraclinical laboratory diagnostic procedure and or treatment are executed. With informed consent, the agreed paraclinical diagnostic procedure and or treatment procedure can be executed. To repeat, before the informed refusal and informed consent are decided upon, the patient must be properly appraised of, must have a proper understanding of the procedures that will be done, the options with benefit, risk, cost, availability, data analysis, and consequences of the procedures like complications, side effects that have to be undertaken. In medical practice, exercising patient autonomy is prominently seen in situations where terminally ill patients have to decide whether to have life-sustaining treatment or not. So whatever their decisions, the physicians will have to abide, thereby respecting patient autonomy. When being managed by relatives or significant others, especially during terminally ill stage, the wish and the decision of the competent adult patient should be respected as part of the right to autonomy. Aside from patient autonomy, the other rights in patient empowerment will include entitlements from physicians managing them and from the hospitals and clinics serving them. The lay people or patients should know these entitlements so that they can demand as part of their strategies to gain greater control on decisions and actions affecting their health, particularly in terms of being recipients of quality and safe services. In my presentation of the other rights of patient empowerment, I will categorize them into entitlements from physicians and patients' entitlements from hospital and clinics. Let me say, though, that there will be overlaps with some similarity in both categories. And note also, I don't guarantee that I will be able to list all of them at this point in time. So let's start with the patient entitlement from physicians. Patients are entitled to choose a physician they want to manage them, and corollary to this, change a physician anytime without having to justify their decisions. Patients are also entitled to have a second opinion from another physician and from other physicians with no limit and without having to justify their decisions. Patients are entitled to have quality services, which consists of the following: patient-centered and compassionate care, equitable care with dignity and no discrimination, effective, efficient, and timely services, holistic, well-integrated, and well-coordinated services, etc. They're also entitled to have safe medical care with no undue harms being inflicted on them. They have the right to information related to their health concerns, meaning they're being appraised on the diagnosis, paraclinical diagnostic procedures and results, treatment, prognosis, etc. They're entitled to have participation in the care decisions with their physicians. They're entitled to have informed consent and informed refusal without prejudice to continuing health care. They're entitled to have medical records of their medical consultation, such as physician notes and tape recordings of the interactions that went on. They're entitled to keep their medical records from other physicians and other hospitals and clinics and for physicians not to get and keep them without giving back or giving a copy to the patients. They're entitled to have no undue long waiting time for medical consultation. As much as possible, there is an appointment time for the consultation, and if physicians are not able to comply, they should at least forewarn or advise the patients. They're entitled to have privacy and confidentiality of medical consultation. They're entitled to know the professional bill or fee or the policy of charging prior to medical consultation. They can complain about the care and services provided without fear of reprisal. So those are just some of the patient entitlement from physicians. Now let's go to the patient's entitlement from hospitals and clinics. All of you probably, or some of you probably are aware when you go to the hospitals, there are posters entitled Patients' Rights and Responsibilities. Okay. This is required by the Department of Health. Okay. So no posters on patients' rights and responsibilities are the same. Okay. So they vary from hospitals to hospitals. So below are just some of my listing on the patients' rights and responsibilities in hospitals and clinics. All patients in hospitals and clinics are entitled to choose a hospital or clinic they want to serve them, and corollary to this, change anytime without having to justify their decisions. Have a quality and safe care in accordance with the generally approved medical and hospital principles. The hospital should have a patient safety program in terms of patient care, okay? And then the safe hospital initiatives in terms of a safe hospital infrastructure. All patients in the hospitals and clinics are entitled to have respect and dignity without discrimination, have participation in care decisions with their physicians and other healthcare professionals, have informed consent and informed refusal without prejudice to continuing healthcare, have a second opinion from alternate healthcare professionals of choice. They're entitled to be asked for consent for additional procedures to be done on them not included in the initial discussion or the initial prescription of their attending physicians. They're also entitled to be asked for consent or refusal to allow additional physicians to manage them beside their attending physicians. Have privacy and confidentiality of personal information subject to applicable laws, have right to information related to their health concerns and services being done to them, have the right to medical records in the hospital and clinics, avail of benefits and privileges in accordance with government regulations, be billed, be charged, or billed accurately. So the patients have to monitor the medications and procedures done so that they can review their bill. Complain about the care and services provided without fear of reprisal. Patients in the hospital and clinics are also entitled to be discharged from hospitals or institutions upon the request and after settlement of accounts, and be treated at the Department of Emergency Medicine, or what is more commonly known as emergency room, without initial deposit, because this is a law. There should be no initial deposit before treatment in the emergency room. They can refuse participation in medical researches. So above, I presented the list of patients entitlements from physicians and patients entitlement from hospitals and clinics. As I said, there could be more that I may have missed. I will update this once I recognize the missing ones. I use the word entitlement to mean patients having a legal or ethical right to have or obtain something from the physicians, hospitals, and clinics. At the same time, they have the right to expect physicians, hospitals, and clinics to act in a certain way that will promote and facilitate quality and safe services to them. Knowing this entitlement will enable the patients to look for them, not to say demand, which redound to patient empowerment, which is gaining greater control on decisions and actions affecting their health. However, let me say that patients should be proactive, aside from the expectations of these entitlements and rights, which may not flow naturally and or smoothly to them. They carry a responsibility to make them happen. They should ask, and if needed, they should demand if they are not being given the entitlements. They have recourses if the rights and entitlements are not afforded them, and worse, if they are in violations. Here are some recourses that patients can do. Remind the physicians, the hospital administrators, clinic administrators that they have to of your entitlement. Change physicians, hospitals, and clinics as indicated. Give feedback and hope for improvement of services. And file a complaint and hope for improvement of the services after filing the complaint. Complaints can be filed with the hospital and clinic administration and or with external monitoring agencies like the Professional Regulation Commission and or with the courts of law. The best promoting and facilitating measure in seeking and getting the rights in patient empowerment to enable patients to gain greater control over decisions and actions affecting their health is to look around now, as early as now, for the right physician, right hospital, and the right clinic. Once found, place them in the list of hotline numbers in the house or in personal files. In case a physician, hospital, or clinics is tested to be undesirable, change right away. Remember, the first right after patient autonomy is that everybody can choose his physician, hospital, clinic, anytime without having to justify. So there you are, rights in patients empowerment. Maximize your knowledge, kaalaman on these rights. Maximize your capability, kakayanan in seeking for and implementing these rights. Lastly, maximize your self-determination or kapangyarihan in using the rights in gaining greater control over decisions and actions affecting your health. With this, I end my pep talk for today, Basic Rights in Patient Empowerment. I hope I have empowered you to have better understanding of the basic rights in patients' empowerment. So before we go to the QA and interactions, just a reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like that shown on the slides. I have placed the link in the chat box and also in the Facebook page and also in the Facebook group. Okay, so just say again, just to show this slide for those who have not seen this earlier, as of August 21, we now have 33 complete elective passers. Okay, so it seems that I'm on target. As I said, the minimum will be 30. Okay. And then for those who have not attended last week's session, let me just repeat this. Okay. I have transformed the pep talk into courses. Okay. 3 categories of courses. One is the core course, health disorder courses, and then health issue courses. Okay. So the core course consists of the one that we had before, patient empowerment program, patient management program, a process, rights in patients empowerment, and staying healthy and contented. So we're done with the other courses except we're done today with the rights in patients empowerment, basic rights. And then next week, we will have patient autonomy and advanced directive. And then the last course for the core course will be staying healthy and contented. Okay, there will be 5 sessions: introduction and intentional living plan, healthy lifestyle plan, screening and periodic health check, early diagnosis and early treatment, and first aid and basic medical care. So the timeline that I foresee is that by October 2, we will be done with the first aid and basic medical care. Okay. So for those who will be completing all the OLETE in the patient in the core course will receive this certificate of proficiency in patient empowerment. And then as to the other 2 courses, health disorder courses, examples of these courses are COVID-19, we already done with that, okay. Cancer course, breast disorder, thyroid disorder, skin and soft tissue disorders, and others that will be developed in the future. Then we have the health issue courses. Example of courses will be the end of life management, palliative care, use of vitamins and supplements, patient-centered care, unnecessary operations, unnecessary medications. So for those who will be finishing the core course plus 2 courses on the health disorder courses and 2 courses on the health issue courses is entitled Certificate of Mastery in Patient Empowerment. Okay. Okay. So with that announcement, let's now have a group picture taking before we go to the question and answer and interaction. Please show your video, turn on your video and show your face. Okay, we'll start with page 1, 1, 1, 2, 3. Okay, let me just save it for a while. Page 2, 1, 2, 3. Okay. Try to take pictures also at your end so that you have a souvenir. Okay. So the floor is now open to questions, comments, and other suggestions, interactions. Okay. Have you experienced all the rights in the past? Any questions? As I said, the hospital are required to have posters that will show rights and responsibilities of patients. No? Okay. So these rights and responsibilities are not all uniform, similar. Okay. So they are formulated by the hospitals. Okay. As long as they have that posters in place, they will have an approval by the DOH or the PhilHealth, okay, to be accredited. Okay. Okay. But I think there will be items which are missing also there. Specifically, they don't usually put there. Patients should have the right to be charged and billed accordingly. And most of the time, that's a problem that I usually encounter with patients. They are not being charged accordingly or accurately. Okay. So then for the the patient's rights entitlement. Okay, I've not seen a copy of that. Okay. So that's why I try to come out with a list that will, based on my experience, and hopefully it will be more or less comprehensive, but I'm willing to add some more if needed. Okay. So any questions? No questions from the chat box? So when you are discharged from the hospital, or even before being discharged from the hospital, okay, take note, my advice is take note of the medications being given to you if you're in the room, okay, jot them down, okay, and then when you get the bill, try to look at the medications being charged to you, okay, so that you can review and make sure that you're being charged accordingly, okay? Then also, if you are, before you go undergo any treatment, any operation, always ask your doctors what is or are their professional fees, okay? So do not just subject yourself to the operation without having a knowledge of how much you're gonna spend, okay? Common problem among patients that I have encountered. Okay, they don't usually ask the doctors how much is your bill. No? So when it comes to settlement of accounts, they'll arise the problems of some misunderstanding or misgivings, no, etc., etc. Any questions?
Good afternoon, Doc. This is Emily. Oo. Doc, I'd like to ask, is this mandated already? Kasi like, for example, yung, especially like, for example, you mentioned yung the additional doctors while you're in hospital confinement. Parang, I can't seem to remember like signing some consent that this doctor will be added into the roster of the doctors taking care of the patient.
Yeah.
Parang alam ko lang when you enter the hospital, there's one consent form for the usually for the procedure, di ba?
Yeah.
Of what you are parang treated for. But then you get surprised. Sometimes you have 7 specialists on the case already.
Kaya nga, okay. As I said, this is probably something new for all of us. That's why I'm creating this program now based on my experience. So you're not usually being asked by the doctors, no? If they refer you to another doctor, they will just call in the other doctor, okay? So wala nang pirmahan na, no? So what you sign when you enter the hospital is usually for the attending only, for the attending, no? Okay. So it's not a usual practice for the doctors to ask the permission of the patient or the relatives if they can call in another doctors. They will just call in the other doctors as they wish, and then magugulat ka na lang, na ganon, na. And then you don't have a chance to talk to them about the reasons why, and then also how much they will be billing you when they come in, na. Okay.
But then, can we cite a certain law or something na parang bill of patient, bill of rights of patients?
Sa ngayon, wala akong nakikita, but I think you have the right to talk to your doctor. Doctor, before when you go into the hospital, can you say, you can direct the nurses, also the doctors, before you suggest you call in another doctor, have my permission first. Okay. That's what I've been advising my patients already now. No? Just tell the doctors. No? Okay. Marami kasi diyang mga things that are not written. No? Okay. Okay. So I guess the doctors will agree. No? it's a little hassle for them because they have to change their habit, no? But I think they should recognize your rights, no? Kasi in the end, you'll be the one paying.
True.
Okay. Okay. Also the laboratory, laboratory exams, no? So a lot of doctors, they don't, kahit na attending mo, they don't ask you. Okay? So they just order as if because ang akala nila, you gave me the full trust, so I can order anything that I want for you based on my judgment, no? Okay. So maraming love din nangyayari dyan sa inyo, no?
Pero usually, in-order to usually sa nurse or, di ba, on duty na like, okay, have this patient undergo several lab exams. So parang hindi first hand na sinasabi sa'yo. So how can you complain in that case? So you ask the nurse to call the doctor or something like that?
Yeah. Before it's being done, because if it's a major procedure, let's say you're now aware that baka malaking gastos ito, malaking procedure ito, no? Which was not previously discussed with me by the doctors, can you say, nurse, hold mo na, kausapin ko muna yung doktor ko. No?
Okay.
No? Okay. Or i-preempt mo na lang kagad when you are admitted, sabihin mo lang sa kanya na, Doc, pwede bang if there are other procedures, especially major procedures that will be done on me, any doctors, new doctors that will be, you will refer me to, can you get my consent first or talk to me first? No? Okay.
Okay. All right. Thank you.
Okay. Any more?
Doctor, can you hear me?
Yeah.
Okay, I'm having problem with my laptop. So there is a question here from Melingo. Is it okay to change physician within the same hospital? Will the new physician accept or treat the patient?
Medyo maingay yung laptop mo. Radis, Radis, can you help,
Radis, at your rights, can you help?
Okay. So the question is medyo may echo, okay. Anyway, okay. The question is, can you change doctors while you are still confined? Strictly speaking, yes, because you have the right, no? Okay. Okay. But knowing our Filipino culture, mga diplomacy, ganon, nahihiya rin kayo, di ba? Okay. Okay. And also knowing that some doctors will be offended also, no? Okay. So it's much better if you can, kung pwede, you get out of the hospital first, no? And then have yourself readmitted to the hospital if you still want that hospital, and then change doctors already, no? Okay. So medyo mahirap lang using based on our culture of yung mga pakikisama, kahiyaan, no? Ganon, no? Okay. So to avoid that, so from the very start, you parang preempt everything na, choose the best doctors that you have, no? Okay. And then as you're attending, kung kanina ka i-refer, no? And then so if there will be a problem with the yung referred physicians, you can always talk to your main attending physicians. Tell him that I don't like the doctor that you referred to me. Can we just change the other doctor? Okay. Okay. So your attending physician whom you trust will most likely assist you there. No? Okay. Okay. Does that answer your question? Si Melingo. Okay.
Yes, Doc.
Okay. Hey, Chuchi, sige. Have you ever encountered a case whereby doctors reported whether a doctor is reported to the proper authorities? Yeah, there are. No? The doctor is reported to the proper authorities by the co-doctor or by the patients. Pwede rin. No? Okay. Meron. Okay. So Chuchi, it's good that you have not encountered such a situation. Okay, but there are a lot, no? Okay. Any follow-up question? Okay.
Example, Doc, kasi I cannot imagine reporting a doctor na you have the freedom to choose naman. So why did you not choose the right doctor? I mean,
Yeah,
you choose before the surgery is done, di ba?
you
So,
choose before the surgery is done. Yes.
oo, you
Okay.
choose the doctor already before the surgery is done. So then it is your fault if there is something that happens in between.
Correct. In that sense, correct. Okay. But there's another situations, no? Because most of the Filipino patients, lay people, do not have a trusted doctor in mind palagi, no? So when they go to the emergency room, they're assigned doctors already. Parang they don't have any choice, no? Okay, because wala kayong kilalang doktor, so ina-assign na lang kayo kung sinong on duty, no? Okay. So in that sense, you don't have a choice, di ba? Kasi binigay lang sa iyo eh, no?
Okay.
After that, you just have to talk to him kung sinong inassign sa iyo, ano yung mga entitlements mo. If you can respect it, agree. Okay, go ahead. So you'll be my attending physicians. Okay, but most of the time, napapansin ko yung mga patients do not ask, do not try to look for their entitlement. No? Okay. And then, sabi ko nga, the best promoting factor here is as early as now, na hindi ka pa ina-admit to pasyente, hindi ka pa pasyente ngayon, no? You have been patients before, but now you are in the wellness stage now, but anytime you're going to get sick, no, you're going to need another doctor. So be ready already with a list of doctors whom you will consult, no? So ang suggestion ko nga is that every family must have a trusted doctor within the roster of hotlines, no? Okay. So that they can consult that doctor who will help you with all the matters in the family, no? Okay.
Yeah, but when it comes to emergency, medyo mahirap nga, Doc, because it's an emergency case, then you really have no choice.
Yeah. Kaya nga, kahit na emergency, pero kung
you know, I experienced only recently. I brought my friend to the ER of a very big hospital right beside our house.
Yeah.
And I could sense it, but because I have already attended your sessions,
Yeah.
parang I wanted them to explain to me everything muna before because they wanted her to be admitted right away. But I knew that she was not really that ill. It's just that I wanted her to be given parang immediate treatment for masakit lang yung tiyan eh. Masakit yung tiyan. So, but they said, no, maybe you should have her already admitted because she's already 90 years old. Does it follow if you're 90 years old, you have to be? I did not want because it was COVID. I mean, we were in the middle of COVID and nobody was going to be with her, no?
Yeah.
So I said, no, you just treat her now. I will wait for whatever outcome. And luckily, she felt better after giving her some yung pampakalma ng tiyan.
Okay. So the age of the patient is not a basis for acting on something, making decision. No? Okay.
Correct.
So the presence of COVID-19 is also not a good basis. No? So what could be the best basis would be the diagnosis. No? That's how I've been telling everybody. No? You start first with your diagnosis. If the diagnosis is just non-specific, simple headache or stomach pain, yan lang, indigestions, no? Okay. So which can be treated conservatively, then you don't have to be admitted, no? But if the diagnosis is something na baka may ruptured appendix or may bleeding, no? That's a different story, no? That's why always
Okay.
go back to the diagnosis. Always ask your doctor, what is your diagnosis before you suggest us to be confined, no? Okay.
Yeah, in fact, they suggested to have a CT scan, and I knew it was going to be expensive, but I said if that's the one that will tell us whether it's something very, very urgent and needs surgery or something, then okay. So we agreed to it, and they did not see anything, but they still wanted for safety daw.
Yeah,
Because,
okay.
oh my
Yeah.
goodness. I
Okay.
said,
Beware.
the CT scan already showed that there was nothing wrong.
Yeah.
And yet they would say, anyway,
Okay.
thank you, because I really felt like I had the right to do it
Yeah, you have
for
the
my
right.
friend, no?
Yeah, you have the right. No, you're the significant others. Di ba?
So
Significant
so
others.
they let us go. Pero yun lang, natagalan. Because, they really took their time to, we got out of the, he was admitted in the ER around 8 o'clock, and we got out around 3 o'clock in the morning already.
Okay. So beware of the
Anyway.
ER, di ba? Beware when we go to the ER has a good side and good points and bad points on that. Now, okay. Yung good points is that you need emergency treatment for urgent life-threatening conditions, di ba? You need that. Now, okay. The downside is that they have a lot of practices which are parang para sigurado, ganun lang, para sigurado, sigurista lang, no? So, but before you subject yourself to those things, the best way is always ask the attending, the one who's treating him or her, no? What is your diagnosis and what is your basis, no? So what do you recommend, no? And then, kung hindi niya masagot, try to pursue it because I want to know the diagnosis, not because you just want to be sure you check up everything, di ba? Kasi you have experience when you go to the emergency room, lahat de kahon na yan. CBC, ECG, chest x-ray, di ba? Okay, oxygen kagad, no? Kahit hindi kailangan, no? Ganon, no? So always ask, no? What is your diagnosis, no? Okay. Okay. And then from there, you after giving you the options, no, they will be forced to give you the options. They will not force you to be admitted, di ba? They should not, no? Okay. So,
I just wanted to point out to everybody that it's really very important to know all these basic rights that we have, no? And to not be shy in coming forward. Pero yun lang, nagtataka ako ba, meron palang cases na nag-file pa ng complaints with the authorities. But I didn't.
Meron. I have my own share. I have my own share as a doctor. Okay. Nobody is free from that. So, okay. Some you have misunderstanding from the patients, you know.
Okay.
Okay. So
thank you.
You can file now. Okay.
Thank you po.
You're welcome. So,
Doctor, can you hear me?
Yeah.
Okay, I'm using my cell phone. There is I think this is a message from Jocelyn P. Just a reminder, before discharge of a patient, loved ones should check the itemized bills. I discovered an anomaly in the nursing station. 12 units of remdesivir were charged to the patients, while in reality, only 10 units were administered to the patient. In another situation, extra sets of unadministered antibiotics were billed.
Okay, thank you. Thank you for reinforcing what I'm trying to say. No? Okay. So I'm telling you based on my experience and because I love you patients, I'm telling you all of these things. No? Okay. So I have my own share of experience then. My mother-in-law got charged with so many things that were not used. So we have to question about it. Diba? Okay. I've seen a lot of these cases. No? So ano lang yun, i-monitor the least that you can do is that when you are in the hospital now, okay, in the room, no, you have a relative now with you, no, whenever there's a medication administered to you, just jot down the name and the dosage given to you. At least you can check it in yung final billing, no? Okay. What you cannot really monitor lang, sad to say, okay. So it all depends on your doctors, on your surgeons, no? Okay. When you are in the operating room, no? Okay. So you cannot really check what were used, what were not used, di ba? So usually the nurses charge all the things that were open, nabuksan, na unsterilized, no? Ordered by a surgeon but not used, pero charged to you pa rin yon, no? Okay. Pero so you just have to trust your doctors who will protect you no? Okay. I usually protect my patients by monitoring the things that I use in the operating room and then check the bill of the patients in the operating room, no? Okay. So, ganun lang, no? So, i-monitor lang ninyo, no? And then, as I said, yung sa ano rin, when yung final billing nyo, kung minsan maraming doctors na hindi nyo kilala, andoon ang pangalan, tatanong nyo, sino-sino sila, di ba? Bakit may charge sila, no? Okay. Okay. Thank you, Jocelyn.
There is another one from Ma'am Jackie Tong. When a person or a family member is hospitalized, I make it a point to bring a notebook or pad paper wherein everything that is done to the patient, temp readings, blood pressure reading, meds, lab works, etc. is written down.
Good. Very good. I hope you can follow that practice, no? Jot down not only the items used, but also the vital signs of your patients, no? Okay. A lot of times now, especially now, you don't have doctors visiting you, no? Okay. Tama? Because of the COVID, no? So they rely on the nurses treating you, no? So if you have somebody whom you can talk to through telemedicine, no? Okay, like me, you can report to me all the vital signs, no? Para I can help you, no? Okay. So I have experiences, a lot of experiences. That's why I don't know how I'm going to put it in my Facebook and appeal to the doctors during this time of COVID. Now I know you're not visiting your patients as often as you want because of the COVID situation, no? But at least just use your Viber. Give the patients access to your Viber and talk to them, no? So a lot of these patients in the room do not see their doctors. They just get the treatment through the nurse, no? Okay? So they're wondering, bakit wala kaming doctor po tumadalaw? Kasi COVID ka eh, no? Ganon, no? But the minimum is that since we have this telemedicine, teleconsult, the doctors probably should provide the patient the opportunity to talk to them through the Viber. Kahit na Viber lang, di ba? Okay. Okay. So any more questions?
Yeah, there is another question for Aida Antonio. Doc, what can you say about this special entitlement benefit for parents of doctors not to be charged ng PF according to Hippocratic Oath when and where it is applicable?
Okay. So yeah, the original Hippocratic Oath is that the relatives of doctor, what do you call that? Let's say the relatives of a doctor, no, should not be charged by another doctor, no? Okay. But usually may qualification yan eh. Dapat immediate lang, no? Immediate relatives. Hindi man lahat ng relatives, no? Hindi sila charged, no? Okay. But over the years, nawawala na rin nga yon, no? But there's some doctors who still honor that, no? Okay. So it's not really a law, it's just a Hippocratic Oath, no? Ganon, no? So if you want to file a case as part of the ethical and that malpractice, okay lang, no? Pero kung minsan hindi rin mahirap i-defend din yon, no? Okay. So, but usually we doctors do not charge parents of our colleagues, no? Ganon. But outside that, pwede na. Okay. Okay. Any more?
There's nothing in the chat box.
Meron isa kanina si ano. Are there government efforts to educate ordinary folks about patients' rights? Government's efforts, I suppose there are a lot of patients' rights. Okay. The only thing that I know of, okay, in terms of government efforts, one, as I said, all hospitals now are required to post publicly, okay, ang mga patients' bills of rights and responsibilities, okay? Because before they get the PhilHealth accreditation, tinitingnan yan, no? But whether this is properly disseminated to the patients, I don't know. Mukhang hindi, no? Okay? So it's really up to the patient to read and memorize all those rights, no? Okay? The other efforts probably will be, okay, indirectly, okay, because most of the hospitals, clinics are accredited by PhilHealth already, no? Okay, so PhilHealth require them to have patient safety program, okay, and then safe hospital initiatives, no? So in that way, they're helping the patients already, but not really educating the patients, no, on the rights, no? Okay. So I don't know whether this is okay, the right thing to say, but I don't think you're going to see what I presented on the patient's entitlement to the patients entitlement from the physicians. There's no formal list on that. I just came out with that one. Okay, but what you have is the hospitals posters on patients' rights and responsibilities. Okay, nakikita naman niyo yan, di ba? Most of the time. Okay. Patients' rights and responsibilities. Yon, meron yon, no? Okay. Pero yung specific na ano, yung sa doctor parts, wala, no? Okay. There was an attempt before, pero palagi ko up to now it's still a rule that the doctor should publish their PF, yung ano nila PF in the clinic, di ba? To publicize it, di ba? Pero hindi lang na-implement yon. No. Okay. Anong suggestion, Maita? Any suggestions on how we can educate the ordinary folks about the patient's rights?
Maybe, Doc, we can also link with other non-profit institutions to somehow insert in their advocacy matters that relate to patient rights and entitlements.
Okay. Anong organizations yun?
I only know one that's from Ateneo, but I don't know if still existing yung Leaders for Health program. Pero hindi ko po sure kung andyan pa siya eh.
My humble opinion is that although what I'm presenting to you is my personal opinion, di ba? Yung mga I call it TPOR, thoughts, perceptions, opinion, recommendations. I've given you a list. Okay, I have thought it out in list na yon, di ba? Okay, before this lecture. So why don't you print that out, carry it with you always, now? Once you are encountered with situations in which you have to demand your entitlement, na? And then, can you just sabi mo, Doctor, these are the lists being recommended by Dr. Also, okay? Whether he will accept it or not, bahala na, na? But at least he will be more aware that there is such thing as entitlement. Okay?
Yes, Doc.
Just try your best lang. Okay.
Oh.
yung sinasabi ko nga rin, yung long waiting time, wala naman sa ano yan. There's no Bill of Rights on that, di ba?
Oo.
Emily, wala naman dyan sinasabi na dapat yung doc, walang queuing, di ba?
Oo.
Wala. Even everything you mentioned, except probably for the hospital, wala. Parang it's up to the organization to
Kaya nga eh.
implement it.
Okay.
Yeah.
So what will we do? We'll just sit down and bahala na. Just be,
Well, naisip ko lang if you can get a friendly congressperson or a senator to do the parang patient's bill of rights na included lahat ito. That's the only thing that can enforce yung mga rights talaga. And at least mape-penalize sila if they don't do that.
okay. That's a long shot. Okay.
I know, but I think that's yung parang yun yung pinaka-ano eh.
Oo.
Foolproof way of ano.
Okay. Yeah, I know.
Because you have something to back you up eh.
Yeah. Okay. Sige. So, but as I said, that's a long shot now. So, ang aking simple suggestion, just remember these rights now that you know. What I mentioned, sensible naman, di ba? Tama naman, di ba?
Oo, Doc.
O mali. No?
Tama naman, Doc. Pero ako, ang personal concern ko is to make our parang knowledge imparted to ordinary people too. Kasi usually yung mga, halimbawa yung mga galing sa malalayong lugar, tapos they don't have this knowledge that we have.
Ganun na lang. Ganun na lang, di ba? Kasi I started with patient empowerment program because I know there's wala pang such a program, na formal program for the layman. No? Okay. So I'm trying to empower you, at least hindi ko rin kaya lahat, di ba? Kaya sabi ko 30 lang, pwede na. 30 lang, no? Pero if there will be more than 30 of you, mas maganda. And then those 30 will try to spread the word around.
Yeah.
Ganon. Yan lang magagawa ko, no? Okay. So kayo
Thank you,
na, I empower you, empower other people, no? Okay. Now, going back, before I forget, okay, yung, as I said, Emily, long shot yan eh, di ba? Even yung, at the start of the present government administration, merong bagong Secretary of Health na, di ba, na-appoint, di ba? Yung babae, di ba? Okay. So, hindi na-approve ng Commission appointment.
Si Doc Pauline.
Sina?
Si Doc Pauline, ano last name? I forgot her name. Basta Pauline yung first name niya.
Pauline. Okay. So she was, merong nilabas ng present administration, no queuing in the public hospital. Di ba? So I pick it up. Sabi ko, I like this. No queuing. Di ba? Kasi sabi ako, I don't like patients queuing also. Pero walang nangyari. Diba? Up to now, may queuing pa rin. Okay? So, but despite that, I'm carrying it out on my own. No? So those have been my patients. Okay? You don't wait for more than 1 hour. Diba? Okay? When you see me. No? Okay? So just try to do your best. Okay? Have a copy, print out na lang yung muna yung copy na yon, and then memorize it, remember it, and then once you're faced with a doctor, can you ask them, Doc, can we have this particular privilege or opportunities, benefits? No? Okay. So bahala na kung gusto niyang tanggapin o hindi. No? Okay. At least you reminded them. No? Okay. Any more?
Yeah, there is a follow-up message from Lolit Ramirez. Doc, how can we address the doctor who keep patients waiting for an hour, not just once, but almost always? Ang nangyayari, pag dumating na po si Doc, nagmamadali na kasi sa dami ng patients na nag-aantay, so di na makapag-discuss ng maayos.
Let me have a show of hands. How many have experienced that? How many have experienced the long waiting time of doctors?
Not with you, Doc, ha?
Lahat pa? Lahat? Sinong wala? Tanggalin mo lang ako. Tanggalin mo. Sinong wala? Wala, no? Okay. So, wala, mahirap talaga, no? Mahirap talaga. That's why, what can you do? As I said, kung, you can change your doctors, di ba? That's the best, that's the only way. Now you can change your doctors, no? You look for a doctor who will be more accommodating, no? Okay. I hope there will be more doctors like me who will not keep you waiting for a long time. No. Okay. Any more?
Yeah, there is from Maria Costa Polotan. Just sharing my family's experience when my mother had a partial hip replacement. One of the nurses advised us to buy our own supplies of bed mats, diapers, and sterilized gloves because these were cheaper from source outside.
So what's the comment lang yan or questions? Hello? One of the nurses advised us to buy our own supplies of bed, because these were cheaper when sourced outside. Okay. So you have a compassionate nurse to help you. No? Okay. So is this a government hospital or private hospital? Kung private, baka mapagalitan yung nurses by the administration. Okay.
Private.
Mostly. Usually I try to, in my practice, I usually try to circumvent the ire of the yung mga private hospital also. No? So, my reason is that I said they cannot afford it. I usually ask them to go outside to buy. No? Okay. So, I don't know. Kasi kung kukunin sa hospital, kung minsan hindi rin mababayaran lahat, it will come out to be utang. No? I owe you. No? So you might, yun ang ginagawa nila kung the patient cannot pay the deposit, yung continual deposit to be, they usually cut you off. You have to secure your own medicine outside already. We won't supply you anymore, di ba? So the same principle. So I'll try to ask them to buy something from outside, which could be cheaper. Okay. So ibabalance lang, baka magalit sa iyo yung hospital administration because you're not supporting the business of the hospital. Okay. Any more questions?
No more.
No more? Okay. So 3:08. Okay. So we'll call it a day. No more, wala nang tanong. If you have more questions, you can, okay, we will officially terminate this session at 3:10, and then you can stay on if you want to ask more questions. No, I'll stay on for another 20 minutes. No, or PM me for any questions that you want to ask. No? Okay. So next Saturday, okay, I hope you will also attend. So we have 44 participants right now registered. I think there are more. Okay, so it will be an interesting topic, very interesting, because most of you have not done this before. I think advanced directive. Okay. Okay. Advanced directive. Okay. So huwag kayo matakot dun sa advanced directive. Okay. So sasabihin nyo, it's something creepy at no? Okay. So we'll call it today, 3:10. So those who want to leave can leave. Those who want to stay can stay on, can chit chat with me for a while, especially those who have not seen before.
Thank you, Doc.
Welcome. You're welcome.
Thank you, Doc.
Emily, kumusta na? Long time no see.
Ay, yes, Doc. Mag-usap tayo.
Sige.
Thank you, Doc.
Thank you, Doc. Goodbye. Thank you.
Thank you, Doc. Thank
Welcome.
you. Bye-bye.
Thank you, Doc.
Welcome. Ana Marie Aloria, kumusta ka na? I've not seen you for a long time.
Okay lang po,
Ana,
Doc.
okay lang. So mag-a-attend ka na every session?
Yes po.
Okay, that's good. So Ana Marie is from
Pampanga po.
Pampanga. Okay. Nice to see you.
Thank you po.
Jess, kumusta yon? Jess? Jess Uy. Kumusta na? Andiyan ba yung Lolit?
Ay, Doc, okay lang po, Doc.
Okay lang. Okay. Kamag-anak ko pala si Lolit.
Actually, sister ko po siya, Doc.
Ha? Ano?
Sister ko po.
Ah,
Sister ko.
sister mo si Lolit mismo? Sister mo?
Yes, Doc.
Okay. Okay. Good.
Medyo busy lang din talaga, Doc. Hindi sila kumakaten.
Yeah, okay lang. So how do you find my my pep talk?
Okay lang, Doc. Very talaga, informative.
Oo. Palagi ko naman, wala akong nasasagasaan ng mga doktor, no?
Well, actually, Doc, ewan ko, observation ko minsan, yung mga doktor may sense of entitlement. Sorry. Not you. I mean, the mere fact that they let the patients wait, diba?
Yeah.
Tapos sa akin, parang okay.
Oo. Yeah, I don't know when they will change that.
Oo.
Long shot nga eh.
Parang, do they owe, do we patients owe them something? Because kumari daw, they studied so many years, tapos before they can earn so many years after pa, mga 30s na sila, doon lang sila mag-establish ng practice. That's the only time they will start earning.
Oh, and then, anong kanalaman sa waiting time?
Hindi, baka, parang God, okay, you wait for me.
Parang God. Ay,
Well,
wrong attitude yon.
oo nga eh, parang okay. Hintayin naman ako ng pasyente ko eh, parang.
So wrong kasi kaya nga sinasabi yung soft skills na hindi na-develop sa mga doctors.
True, oo.
Communicate.
Pero, true. Actually, going back to soft skills, my finding, because of our home healthcare, 50% of healthcare is soft skills.
Yeah.
Rather than, 50% is medical, 50% is soft skills, actually.
Bakit napili mo 50? Bakit hindi 60?
And then, sige na. Well, syempre, of course, the process behind it is 50. Pero, for the patient to get well, parang, you have to address the psychosocial, first, issues of the patient. Kasi pag hindi nag-cooperate sa treatment,
yeah,
you're not gonna get anywhere, no matter how good you are a doctor.
Yeah, okay. Tama yun. But I don't know how you quantify that. Sa akin, sabay, dapat sabay, di ba? Dapat sabay.
Well, for you to get the cooperation nga eh. Hindi kasi yung experience namin sa patients, for those, hello, sa mga participants, for those here, kasi we run a home health care company.
Yeah.
So we do COVID, we're in the thick of COVID kasi we are the partner of one big hospital here in Metro Manila. Kaming home care services. Pero this is not related to COVID, pero yung mga past patients.
Okay.
Before you can get them to cooperate, sumari daw yung treatment and wala. Kasi we incorporate health and wellness into our treatment plan.
Yeah.
So you need to get their cooperation.
Yeah. Okay. So sa akin, yeah, dapat sabay. But if you want to put weight, dapat mas kasi yung medical process, di ba? Yung process of marriage.
Yes.
May konting angat, konting probably 60%, gano'n.
Yeah, maybe.
Okay. Kasi without the medical process, wala rin, di ba? Okay. Pero I agree with you, dapat merong psychosocial aspect.
Actually, going back, kasi kanina you were telling me about yung doctor sa hospital. Diba, they rarely visit the patients or they rarely communicate with the patients. Baliktad naman sa home care. Kasi for this COVID home care, very crucial talaga yung virtual consultation with the doctor because they involve the family. Kasi before we engage them, we ask them, who do you want to be included in the Viber calls? Actually, it's a Zoom call, face-to-face eh. We prefer Zoom eh. Kasi minsan yung mga symptoms, ganon. And very appreciative kasi ang daming apprehensions ng mga family, di ba?
Yeah.
About they want to know what's happening. Minsan affected din sila kasi they belong to the same household. So even yung infection control sa mga bahay, we also teach them how to do that.
Good.
Yun.
Okay.
So, tsaka you have to minsan ang dami nilang, syempre, natakot sila, they don't know what to do. So,
Yeah.
parang kasama dun sa virtual consultation is papakalmahin mo just to assure them na, okay, ito yung mangyari, ito yung what to expect, ano yung treatment, ganun. And then, after that, once you get their trust, parang you have to gain their trust first. So, parang na siya, medyo okay na siya after that. And they really appreciate that. Sobra-sobra.
Yeah, I agree. I agree with you, lalo na ngayon sa COVID. No? Okay. Have you heard about Telegabay?
Telegabay. Parang narinig ko na siya dati.
PGH? PGH.
Talaga, yung
then
teleconsultation.
Yeah, free consult for patients with possible COVID, di ba? Okay. Because we really wanted to decongest PGH kasi baka
Right.
PGH. So usually Facebook na Messenger, parang consultation na lang, na ganon. And then you also have the bayanihan ni OBP.
Yes,
Okay. So yun din, no? Ganun din, no? So actually, before the Telegabay, before the OVP, I started offering free advice already for COVID treatment. No? So then, nung dumating itong Telegabay, sumali pa rin ako. Okay? Sumali din ako sa OVP. So,
okay.
Every Tuesday ang duty ko sa volunteer duty sa Telegabay. Every Thursday sa OVP Telegabay. Usually, I just communicate through them through cell phone or through Facebook Messenger, no? Kung minsan Zoom, if they have Zoom, no? Okay. So usually ang gamutan nito in family eh. No?
True. Lalo ngayon, like we've had.
Yeah, even that last March, sabi ko, when we had that Telegabay, so I was telling my group mates, sabi ko, you don't treat one patient lang, you treat the whole family, di ba? Ganon. And then, kaya ang hinadakit ko lang kasi, yung mga nasa hospital, hindi dinadalaw ng doktor, let's say, ayaw nila dumalaw because of the risk, but they should communicate with the patient. No?
True.
So ako, whenever I have these patients, I usually give them my Facebook account, no, Messenger. So they report to me every day up to, let's say, they have to be isolated for 14 days. Kumisan, sabi ko, sige, you give me update up to 14 days until mag-clear ka. No? So may monitoring. No?
Kasi our program includes, parang package na siya, may lab siya. So parang all you have to do is just to call one number and we will arrange everything from labs to med visits to Zoom consultation. Kasi aside from us, parang we case manage or we coordinate. There's an attending physician from that hospital that we are partners with.
Yeah. So maraming package yan dyan, di ba? Manila Doctors has a package, Medical City has a package. No? Pero sinasabi ko sa Telegabay group ko, the reason why I want to join you because ayoko yung mga packages. Because sabi ko, because of this pandemic, I am offering my free service to the Filipino people. I don't like to charge them. No? Now here comes yung mga hospital coming out with packages riding on the crisis, di ba? So a lot of them, parang isang hospital bill package sila 16,000. 16,000. Walang gamot pa yon, ha? Basta visit.
Walang gamot, walang labs yun.
Oo, walang lab, no? Kung may lab pa, mas mahal. Ha? Okay, so when I do teleconsult here with my COVID patients, no? Halos kasi ang emphasis naman nito is really home care, supportive lang, di ba? Monitor mo lang, no? So the most ang gagastusin naman nila probably oxygen kung kailangan, di ba? Okay. And then the others, I don't usually prescribe yung azithromycin is not used na medication yon, di ba? Saka yung mga vitamins, no? So sabi ko, rest lang, pagkain lang, inom lang, ganon, no? So napapagaling ko naman sila.
Well, minsan case to case kasi madami din kaming patients na we have to refer to the hospital after a while. Dahil hindi na pwedeng i-manage at home.
Yeah. Kasi kaya nga, kailangan i-monitor di ba? So you can do the monitoring through Viber or through ano. So every day nagbibigay sa akin ng update kung ano, yung temperature, pulse oximeter, no?
Yeah, pulse ox, tsaka
respiratory
temperature, BP.
Okay, respiratory rate, monitor ko every day. So luckily, I have a lot of patients who survive, no? Hindi makita.
Yeah. Pero ang nakakatakot ngayon, we've had patients as young as 3 years old. 3, 5, 6.
Namatay?
Hindi, nando pa naman sa
Okay.
Nando pa naman sa graduate na yung iba sa program. Pero nakakatakot na parang wow, younger na sila.
Yeah. It's a known fact na maraming bata na affected.
Dami.
Pero at least konti pa naman namamatay yung mga bata.
So far, I don't know. Wala pa naman.
Yeah. Wala pa naman eh. Ako rin, from my experience, I have a lot of baby na positive din. So I told them just stay home, no? Just keep me update kung ano.
Yeah, pero nakakatakot din is 50% of our patients are vaccinated.
Wala nang protection. No? Okay. So stay home pa rin. Just wait for herd immunity. Yeah. Herd immunity.
Well, preventive, of course, you have to be healthy.
Yeah, yan nga, supportive Kaya yan ang panlaban ko, increase my host resistance. I started my pep talk with those COVID lectures, tatlo. COVID safety program, home management, hospital management. Kaya sabi ko sa hospital naman, I told them the basic principles because I'm not actively involved sa hospital. Pero pag sabi ko sa hospital, pag pumasok ka, sky the limit na yan kung ano ibibigay sa iyo. No, lahat. No, tama?
Oo, times 2.
More than that.
Yeah, because of yung mga yung mga PPEs, respirators, etc.
Dapat ng 500,000 kumisan.
Pwede. Kasi we also do in-hospital care, our home care specialists. Hindi pwede, the hospitals try to limit yung mga taong pumapasok. So our parang skilled caregivers, sila yung nagbabantay. Yeah. Pati sila naka-total, level 4 PPE respirator.
Yeah.
Ang hirap din for them.
Yeah, mahirap na. Gastos, gano'n. So, actually, saka coordination, ang hirap mag-coordinate doon. Kaya magastos din. Kasi pag pumasok ka ng hospital, right away you have 2 doctors attending. Tama?
Yeah. I'm not sure. Infectious siguro.
And pulmo.
Most likely.
Okay. Yan ang napapansin ko. Have been wanting to ask those specialists, how do they coordinate? So, kasi yung ginagawa ng infectious, they give medicine, di ba? Okay. Yung pulmo, pwede din magbigay ng medicine. Antibiotic, gano'n. No? Plus pulmonary care. No? Parang nag-overlap na, kaya nadodoble yung gastos ng pasyente. No? So, So the pulmo, parang ako, I can order, I'm a surgeon, so I manage patients sa outpatient, di ba, sa home care. No? I can prescribe dexamethasone, I can prescribe yung azithromycin, di ba, ganon. No? So,
Hindi pa.
without extra charge to the patient. Na? Okay. Pag pumasok sa hospital, meron ka ng infectious disease person there, and then pulmo, okay. So tinatanong ko, sinong mag-order ng remdesivir? Sinong mag-order ng tosi? Okay.
Yung infectious disease doctor. Well, sa amin merong may yung doctor mismo na pulmo yata siya.
Pulmo. Eh, anong
I
ginagawa
think
ng infectious disease?
I'm not sure kung infectious ba siya. Tingnan ko muna kung ano. Pero sa amin, isang doktor ang nag-clear. Depende kung sinong assign sa kanyang doctor.
What I'm saying,
There's some doctors na nag-round because yung our doctor, yung chairman namin sa company, I'm sure kilala niyo siya, tiga PGH, siya si Dr. Raul Destura.
okay. Nagra-rounds siya. Nagra-rounds.
Kaya na-angioplasty. Sorry.
Yeah. So,
siya, minsan meeting kami, nasa hospital, nagra-round.
Yeah, pwede. Pero kaya nga, coordination importante doon eh. In the end, it's the patient. Pati ito lang may PhilHealth package, di ba? May PhilHealth, no? Pero,
yeah, for hospitals, yeah.
I have a niece who got hospitalized just last week, no? Pregnant na nag-deliver, no? May COVID, no? So, maabot ng almost 500,000 ang gastos niya, no? 500,000. At nakita ko sinong nagcha-charge na doktor, di ba? So, may infectious, may pulmo, may, of course, OB, okay lang. OB, saka anesthesia, no? Tapos may hima papasok because of the TOC, no? Ganon. So, which can be ordered by infectious disease o kaya yung pulmo, di ba? So, kaya napapamahal eh kung ano.
Yeah.
Kung ako lang, let's say I'm the one managing a patient sa family at home, ako lang nagde-decide which medicine to take. No? Wala nang added cost of another doctor. Anyway.
I'm sorry, naano ko yata, na-monopolize ko yata.
No, okay lang, nakikinig mo.
Yung nakikinig mo, sila Ma'am Pearl at si Ma'am Cecilia. So, ayun, very, very interesting times.
Pero kasi I think the habit is carried on, yung hindi nagbibigay ng ayaw magpa-disturb ng doctor through cellphone, through their cellphone, di ba? A lot of doctors, they don't want to give their numbers, di ba?
Some are not techy. They're not. Doc, nandun ka doon ka sa medyo.
Wala na yun, yung mga cellphone.
Hindi, yung mag-a-arrange ng Zoom meeting. Yung
kahit na cellphone na lang, even before the COVID, di ba? Doctors do not want to give out their cell phone numbers because they don't like to be disturbed. They don't like to be, di ba? Kaya ngayon, sinasabi ko, kahit na hindi kayo makapag-rounds, dapat gamitin na niyo yung cellphone niyo to communicate with your patients, di ba?
Well, yung mga iba pwede naman, pero may bayad yung consultation.
Okay lang, hindi. Parang yung nasa hospital, yung mga doctors nag-charge per room rate, di ba? Per room rate, di ba? Bawat stay ng hospital, pasyente sa isang hospital, let's say, ang room rate is 3,000. Ang PF ng doctor is 3,000 per day, di ba? Okay. Kahit na kung minsan wala ring visit, di ba? Okay.
Oo. O yung intern lang nila nagbe-visit.
Oo, okay. So, ang sinasabi ko sa kanila, total nag-charge kami yung room rate. Pagbigyan na yung pasyente, pag hindi kayo makapunta ng hospital to make dalaw, to make rounds, at least talk to them through Viber, through cellphone. Kasi mga pasyente nagko-complain, no doctors are visiting them.
Oh, okay.
Ganon. So, syempre hindi lahat, no? Pero a lot of the people that I heard of, nagko-complain na, wala kaming doctors nakikita rito. I was trying to tell them, kasi may COVID ka eh.
True.
Pero sabi
Mahirap.
ko, at least the doctor should communicate with their patients through Viber o kaya through cell phone.
Baka takot din sila kasi may comorbidity.
Hindi, wala. Hindi, kausapin pasyente, anong status mo, what you need, advice. No? Okay.
All right.
Nice to see you. Nice to see you. Okay.
Alam ko yung advance directive.
Yeah, I will try to come out with the yung subsequent program, advanced directive, healthy lifestyle. That's why as I said, it's everything's based on my personal opinion. I don't like to claim that it's a gospel truth or kasi maraming doktor na hindi won't believe me. Okay.
Oo. Well, recently, parang isa lang yata nag-ask sa amin kasi we can provide advance directive. May form kami for that.
Yeah.
So recently, we had a patient end of care. Alam na ng family. Accepted na ng family na she's about to go. And then, she wanted to stay sa bahay na lang. If ever gusto niya sa bahay. She has been hospitalized on and off. And to think they're connected with a hospital. So parang pagod na daw siya, nakikita niya all machines, and she knew she was nearing her end of life already. So siguro she wanted to be with her loved ones.
Yeah.
So tinanong ko doon sa doctor namin, parang they're a family of doctors. Why do they have to call us for yung end of life care?
Oh.
Sabi nung anak na doctor, sabi niya, it's time for me to stop being a doctor and be a family to the patient. Parang ganun. And start being a family. Ganun yung reasoning niya.
Okay.
Well, there are some things siguro din kasi 'di ba, if you're a doctor, sige, the best possible care, gusto mo pa talaga na pero kung if you're being a family, nando ka to console everyone or to prepare your family for and to prepare yourself also for the end of life scenario. Yun talagang na. So, yun, when she passed on, parang we were the ones who managed the yung kanyang care.
Okay. So, mahabang discussion yun How should a doctor behave, no? Example, sabi nila, I cannot operate on my relatives, di ba? For one.
Parang ganun.
No, di ba? So, ako naman, I don't believe in that, no? If I can make a good judgment kasi as a doctor, you should not be affected by emotions, di ba? Basta clear ang mo, no? If you cannot do it, you refer, you delegate it, di ba? But ideally, as a doctor, you should be very objective in everything, di ba? So go ahead and treat, no? Parang kahit na relatives mo, you treat your relatives, di ba? Or even yourself, baka sabihin nila, yung palagi naririnig mo, yung mga doctors are the most difficult patients, di ba?
True, ang tigas ng ulo. Minsan.
I don't think it's true It's because I know what's going on, di ba? Ganon. Okay. So, ganon din dito sa, let's say my relatives is going to die, no? Ganon. I just look at it very objectively, no? If it's really terminal, wala akong magagawa, let him go na in peace, di ba? Okay, just help him prepare for the eventuality,
True. Parang ganun na nga nangyari.
So, hindi na yung reason because relatives ko mababack out ako.
Well, yung iba kasi they cannot emotionally siguro detach themselves.
Kaya nga
medyo tabu kasi sa Pilipinas itong advance directive. Ayaw nila pag-usapan talaga as much as possible.
Kaya pag-usapan ko next week. Okay.
Sige, Doc. Sorry ngayon na ako kasi holiday ngayon. Wala akong meeting. Saturdays may meeting ako usually.
Okay. You can, nasa pep talk group ka ba? Pep talk group? Yung group?
Hindi ko na matandaan kung ano.
Itong grupo na Facebook group. Where did you get my notice ngayon?
Sa personal mo yata. Parang may invite yata ako that one time pero I forgot na.
Okay.
Ang daming, everything's piling up.
Okay. But if you don't have time to attend this live talk, no, ganon, I usually post the recording sa
Good. Sige.
FB, no? So actually, this is my 13th. This is my 13th session na no? 13th session. Butit na lang, I now have 33 who answered all the olete. Olete means that parang online test, no? That's my
yung sister ko nakakuha ng isa yan. Si Elsie.
Si Elsie kumuha. That's my only way of gauging whether they have really learned, di ba? Kasi kaysa yung mag-a-attend lang, labas-pasok. Di ba?
True.
So, at the end of the day, I can say that 30 who got a certificate.
Enlightened patient. And empowered patients. Enlightened and empowered patients.
Okay. So 30 lang, and kayo na mag-spread the word.
Yeah.
Okay.
Sige. I could use it for our business too. Yun. Parang nakita ko, oops, ito ginagawa namin. Ito hindi namin ito ginagawa.
Business school? Sana? Ano?
And then our business, diba? Definitely true ka na before we give them a quotation before we do any labs. They have to accept it. Otherwise, we don't do it.
I think there are very few lang now. There are few people, few institutions, few organizations doing the right things. Yeah. Okay. So, appraising the patients properly. No? Okay. So.
All right.
Okay, sige. Bye-bye.
Sige, nice seeing you. Thank you.
Bye-bye.
Stay safe, everyone. Sige, bye-bye.
Okay, bye-bye. Abet, end ko na. Wala na pala si Abet. Okay. Let's see. Mary Ann, kumusta ka na, Mary Ann?
Okay naman, Doc. Doc, pasensya na. Nawala lang Converge kagabi. Alas 9 hanggang kanina alas 8. Hindi ko tuloy nagawa yung ulit eh.
O, sige.
Pasensya na, Doc.
Habol ka na.
Kasi ako, Doc, habol gagawin ko ngayong weekend yun, Doc.
O, sige.
Naka-duty rin kasi ako po eh. Hanggang ngayon, naka-duty rin.
Sige, habol ka lang para mapasama ka dun sa elite group. Elite group yun, natawag ko. First 30, first 40. Di ba?
Apo, Doc.
You will go down in the history, in the annals of history. Biro lang. Okay. Sige, habol ka lang.
Apa.
Okay. Congratulations, Perla. Congratulations, Cecil Cruz. No? Okay. Okay, bye-bye.
Bye, Doc. Thank you po.
Bye-bye.